Wednesday, September 29th, 2021. Right now, across the state of Maine, the Maine CDC is reporting 89,064 cases of COVID-19, representing an increase of 867 cases since yesterday. Since the beginning of the pandemic, 2,475 people have been hospitalized. And we've sadly had over 1,000 deaths in Maine, 1,022 to be precise, that are attributed to the COVID-19 pandemic. Right now in Maine, 225 people are in the hospital. 71 of them are in an intensive care unit bed, and 31 are on ventilators. Right now, in the state of Maine, there are 41 ICU beds that are available. In terms of testing, our 7-day PCR positivity rate right now stands at 4.6%. 2 weeks ago, for reference, that number was 6.1%. So we've seen a reduction in our PCR positivity rate over a single incubation period. A large portion of that is a function of our increase in testing. Right now, the PCR testing volume across the entire state stands at 568 PCR tests for every 100,000 people in the state. 2 weeks ago, that number stood at 477 per 100,000. It means we've increased the amount of PCR testing that we're doing in the state by 19% just over a single incubation period. That's an important thing, because without testing, we can't get a sense of where there are cases that are happening. By increasing testing by 19% over a 2-week period, we have a better sense for how the pandemic is unfolding in Maine in as close to real time as possible. Turning next to vaccines and vaccinations. As of this morning, 68.4% of the entire population of Maine is now fully vaccinated. 68.4% of individuals 0 on upward. That's the third highest rate of any state in the United States. 0.2 percentage points behind Connecticut and about a percentage point behind Vermont. Let's keep that going, Maine, to see if we can eclipse Connecticut and perhaps even Vermont. The number I want to draw really close attention to is how we're doing on vaccinations for our elderly Mainers. Those, for example, who are 65 and over. Of Mainers 65 and over, 98.6% have had at least one dose of COVID-19 vaccine, and 93% are fully vaccinated. Those are important numbers and really indicative of how well protected older Mainers are against COVID-19. But I also want to zero in on some differences that we have with respect to vaccine rates across the state. It's not so much the aggregate number of how many people are vaccinated, it's where those individuals are. Vaccination, in order to be effective at a population level, we need to have equal coverage throughout the state. And right now in Maine, we have a variance, with some counties in Maine in the range of 70 to 75% of individuals who are fully vaccinated, while other counties in Maine are in the range of around 50% fully vaccinated. It won't surprise anyone to hear that there's a correlation between vaccination rates at the county level and COVID-19 rates at the county level. One of the best things that anyone right now in the state can do, particularly in rural counties, if they want to keep themselves safe, take pressure off of hospitals, and try to keep everyone in their community safe, is to go get vaccinated. I'm going to come back to vaccines and particularly boosters in just a minute. But I also want to take a moment to talk about where we stand with respect to reviewing positive case reports that have come into Maine CDC. As of this morning, we were looking at about 2,500 cases that were awaiting review by Maine CDC epidemiologists. Now, what does that mean in particular, and what are the implications of that? Well, let's first start by remembering that cases are reported to Maine CDC from laboratories across the country on a rolling basis electronically. Those reports come in throughout the day and throughout the night as laboratories across the country test COVID-19 specimens on Maine people or people that reported their address as being in Maine. So what does that 2,500 really mean? Or in particular, what does it not mean? Well, the most important thing I want to note there is that these are not individuals who tested positive, who remain unaware that they have tested positive. I want to say that again. These are not individuals who somehow got tested as positive and who don't yet know that they are positive. If you test positive for COVID-19 in Maine, you have been notified through multiple channels, perhaps including the laboratory that ran the test, the provider who ordered the test, as well as the text messaging platform that Maine CDC and Maine DHHS operate. Those who test positive are given information not just about their positive status in real time, but as well as given information about what to do or what not to do, and are also offered information about social services and support. That happens in real time as the test results are run and as people get notified, again, by their laboratory, by their provider, and by our text messaging platform. So what does this review, this queue of samples that are awaiting review mean? Well, what it means is it affects the number of new cases that we list on our website on any given day. It means that if you received a positive result in the last 36 hours, you might not be part of the number that appears on the Maine CDC's website today, but you might be tomorrow. That's because we have to process every single test that comes in to make sure, for example, it's not a duplicate or not a result on someone who's actually in another state. But that doesn't affect whether it's a case, whether people got notified, and what social services are made available to them. It's also why, at this point in a pandemic, we don't just rely upon a single metric to help us understand how things are unfolding in real time. That's why we use multiple metrics as the US CDC recommends. Things like the positivity rate, which is not affected by this. Hospitalization rates, which are not affected by this. We're making progress on this front, but I wanted to take a moment to let everybody know what this means and in particular what it doesn't mean. The last thing I wanted to touch on today is boosters. We've talked a lot about boosters over the last couple of weeks, and thanks to a lot of work by our federal colleagues, we now have a little bit more clarity around them. I'd like to take a moment to talk about boosters and answer what I think are the 4 most common questions that are coming in around boosters right now. Number 1, who should get a booster? Number 2, why they should get one. 3, when they should get one. And 4, where they should get one. Let's first talk about who should get a booster. And there are a couple of categories of folks who, according to the US CDC, are now eligible for a booster. This includes folks who are 65 years of age and older. It includes any resident of a long-term care setting. It includes folks who are over the age of 18 who have an underlying medical condition. It also includes folks who are over the age of 18 who are at an increased risk for COVID-19 exposure or transmission because of where they live or more likely where they work. Those are the categories of folks that, according to the US CDC and Maine CDC, should go out and start thinking about getting a booster. But why? Why should they get a booster? Well, the data that were reviewed by the US CDC last week showed that after getting vaccinated against COVID-19, protection against the virus may decrease over time and thus be a little bit less likely to protect against the Delta variant. This slightly lower effectiveness is due to two things. Number one is just the passage of time. As time passes, the protection afforded by vaccines can go down. This is what we call waning immunity. The other reason is the greater infectiousness of the Delta variant. These two things, in tandem with one another, waning immunity plus the Delta variant, explain the case for why boosters are important in the categories of folks that I mentioned. Now, a lot of this isn't new. For example, waning immunity happens with virtually all vaccines. And as a result, for most every other vaccine out there, booster doses are a standard part of the schedule. But here's what's really important that I want to drive home. Being eligible for a booster does not mean that the protection offered by the vaccine that you got has fallen to zero. I want to say that again. Being eligible for a booster, being in one of those categories, does not mean that the protection that you are getting from having been vaccinated has fallen to zero. Indeed, the US CDC reviewed data that showed that the existing COVID-19 vaccines remain effective at preventing things like severe disease, hospitalizations, ventilator use, and death. That being said, although the vaccines remain effective, because we know the passage of time plus the Delta variant may impact for some categories of folks the overall effectiveness, boosters are being recommended. So when should you get a booster? Well, those who are eligible should get their booster shot at least 6 months after they got their second shot of Pfizer vaccine. The operative words there are at least 6 months. Although you're welcome to, you should not feel the need to be in line for your booster shot precisely 6 months to the day and hour that you got your second shot. Boosters are important, and you should walk, but not run to get one. They're important in the same way that other preventive health measures this fall are important, like getting your flu shot, which reminds me, you can get your flu shot at the same time you got your booster. If you haven't gotten your flu shot yet, get them both at the same time. And finally, where should you get your booster? Well, you can get your booster shot in any location that is administering the Pfizer vaccine. Some folks will want to go to a large site, like the one that the York County EMA is operating in Sanford, in the former Marshall's building. They're open Tuesday and Thursday afternoons and evenings, as well as Saturday all day from 8 a.m. to 4 p.m. I was there over the weekend, and they were seeing a healthy number of folks come in and get their boosters. Some folks may want to go to the Auburn Mall, which is also open and giving shots Tuesday through Friday. Others may feel more comfortable going to their local pharmacy or even going to their doctor's office. To find a site near you, I recommend searching for Maine COVID vaccine sites and going to the state of Maine site. It's always a good idea to call before you one of those locations just to make sure they have the Pfizer vaccine on hand and ready to go. With that, I'm going to turn things over to our colleagues in the media today. The first question for the afternoon goes to Patrick Whittle.
Thank you very much. As a former Connecticut resident, I'm sure we can eclipse them at everything. So I have a couple of things that I would love to bounce off of you. One of which you were just talking about in terms of the urban-rural divide. Just looking at the positivity rates, in Somerset County, the positivity rate is more than 9%. I believe in Washington, it's around 7%, these are numbers that are 2 and 3 times higher than we're seeing in Cumberland. So what can the state do to tackle this?
Yeah, Patrick, I'm glad you raised that. And you're certainly right. What those high numbers tell us is, in effect, that there's not enough testing happening in those parts of the state. As you'll recall from earlier days in the pandemic, Patrick, Our goal is to keep the positivity rate under 5 if possible. That's a marker for knowing that we're doing sufficient amounts of testing. And so in those counties, Somerset, Aroostook, Washington, Piscataquis, where the positivity rates are a good bit higher, it's a signal to us that we need more testing options. We're working on a number of things. We're still waiting for confirmation on a couple of the pieces. So I don't have any announcements yet, but rest assured, we recognize fully that testing is a challenge. I know our team is, again, right now really focused on Washington, Aroostook, and Somerset to try to make community level testing a lot more accessible. Again, I want to shore up a couple of more pieces before we announce anything. So I don't have anything there, but other than to acknowledge it's an issue, it's a concern, and we've taken some steps to try to alleviate or improve the access to testing, particularly in pharmacies.
Okay, terrific. Also, there's been some sort of, I've fielded some questions, I guess I should probably say, from some readers who have been asking just how many children in the state of Maine have been hospitalized due to COVID-19. Are there data available about how many children, say under 18 years old, have been hospitalized with COVID symptoms in the state, and how many are presently?
Yep. So in terms of overall hospitalizations in the state of Maine, we break it down by things like ICUs, cumulatively and current, and so on and so forth. As of right now, Patrick, as of Monday evening, there were 2 children in the state of Maine who were currently in the hospital. May have changed a little bit since Monday. In the past 30 days, since Monday, there were 5. And in terms of ICU breakdowns, we've had 1 child in the past 30 days who had been admitted to the ICU for COVID. And cumulatively, since the beginning of the pandemic, there have been 9 children who had been admitted to the ICU. This is below the age of 18.
Okay.
We update those numbers periodically. We try to update them twice a week, hoping for an update today or tomorrow. So just to caution that in the midst of a pandemic, those numbers change. So it might be a little bit out of date, but just wanted to let you know.
So these are children who have been in the ICU, not who have been just hospitalized, or are those separate? Yep. Are those separate?
No, they're separate. So currently 2 children who are in the hospital, no children right now in the ICU that we're aware of. And then in the past 30 days, 5 children generally, one of whom was in the ICU. And cumulatively throughout the pandemic, 9 children who were sick enough with COVID to need ICU admission.
Is it possible to know how many children have been in the hospital at all cumulatively?
The number that we have as of Monday was 32. But again, I know we're updating them right now. And so I don't want to give you numbers that are out of date, but as of Monday, it was 32.
Okay, terrific. It's great to get these statistics out here, because I'd heard some concern from some readers that they were hearing rumors that these numbers were much larger. And this, obviously we would love all these numbers to be 0, but these are these figures, would you describe them as manageable for the state's ICUs and hospital beds?
I don't know that I think the answer is yes. And again, I touched base with healthcare providers to get a sense of both pediatric and adult hospitalizations. They're certainly sad insofar as that's a lot of kids' lives who were disrupted by needing to be in the healthcare system. Certainly needing to be in the ICU is about as difficult for a child and their parents as you can imagine. But right now, in terms of the availability of ICU beds, children's hospitals in Maine are already stretched, not because of COVID, but because of things like RSV and other viruses. So we're keeping close tabs on it. We're not in emergency mode with respect to children, but I'm keeping pretty close tabs on it.
Okay, terrific. Thank you very much.
Yep. Thanks, Patrick. Let me go to Brian Sullivan next.
Thanks, Dr. Shah. I wonder if you started your vaccine series with Pfizer. Are you still waiting or not with Pfizer, started with Moderna or Johnson & Johnson? Can you get Pfizer now? And maybe the latest you're hearing about approvals for the other two?
Yep. Brian, not to make light of your question, but I was typing up my notes and I thought, gosh, should I put something in about mix and match? And I thought, no, someone will bring it up. So here's the bottom line with respect to mixing and matching. If you started your COVID-19 vaccine series with, say, Moderna, and you got your first 2 shots with Moderna, I think you're probably wondering right now, what about me? Especially, or if you got J&J, the same thing. What about me? Can I go out and get a Pfizer booster? Well, right now, there aren't a lot of data that have been presented to really know whether that's safe or effective. But the signs point to it being both safe and effective. Indeed, Dr. Fauci noted last week that his agency is running a very large 9-part study to try to get at the bottom of this. But right now, the US CDC does not recommend that folks who got the Moderna shot go get a Pfizer booster. But from what I understand from the meetings last week, that is very much in the process of being evaluated, and they're hoping to have some answers there relatively soon. The same thing with boosters of folks who got Moderna. So let's say you got Moderna and now you want to get your booster with Moderna. As I understand it, that data too is soon to be submitted to the FDA. It has been submitted. They're evaluating it, and we'll probably have news on that from the FDA and CDC. I hesitate to put a timeline on it, but as I understand it, it's in process right now.
Thank you. And this might be a crystal ball question, but if you go through this process still and you have people getting vaccinated and then people getting boosters, and you have a portion of the population that just won't get it, that are eligible and aren't getting it, what does that look like as these cycles go forward? Is that too far down the line to forecast, or can you give us a little insight there?
Well, it's a bit difficult to forecast more than just a little ways out because there are so many variables. But Brian, your question brings up a really important point. Although boosters are important, as I noted, and I wanted to talk about them today to avoid any confusion around them, our focus at the agency still really remains on first doses. We're really focused on getting folks who haven't yet been vaccinated, getting them in line, getting them a golden ticket of sorts to know that they should go out and get vaccinated and be safe. We're not letting up on that piece of our work. We're working on media campaigns, ways to interact with folks. If folks don't go out and get vaccinated, particularly in the near term, we're going to continue to see pockets, regions of the state with really high transmission levels. Now, you might say, well, hey, that doesn't affect me. I live somewhere else. I don't live in one of those parts of the state where there might be those pockets of transmission. But you could still be affected. Someone from another part of the state who becomes acutely ill and needs to be transferred to a tertiary care hospital may end up occupying a bed, and it may be your uncle or your neighbor who breaks their hip and has to compete for that same ICU bed just for that same reason. So the impact of not getting vaccinated reverberates well beyond your own community.
Thank you.
Thanks, Brian. Let me go to Megan next.
Thanks, Dr. Shah. A few weeks back, we talked about the demand outstripping the supply when it came to testing and testing supplies. So with this increase in testing that we're talking about now, I think you said 19% increase. Are we caught up? Is the supply caught up with the demand?
Great question, Megan. I'm glad you brought that up because I remember your question from a couple of weeks ago. And I don't think I was as precise when I answered it a few weeks ago. And I've been debating whether to try to be more precise on that before, but I'm glad you raised that. You know, what we talked about a couple of weeks ago was the crunch that we were feeling, that all states were feeling around the availability of the rapid test, For example, the Abbott Binax Now test. And what you and I had talked about on this briefing a few weeks ago is whether schools might need, would see whether schools were going to get shortchanged, because for many schools, Binax Now is a backbone of their testing programs. And what I should have mentioned but didn't, Megan, is that even though we were concerned about our supply, at no point did we have to shortchange a school and not give them what they needed in order to keep kids in the classroom. That was true 3 weeks ago. Thankfully, it remains true today. We've been working with the manufacturer to make sure we can secure even more of those tests. And again, I don't want to get ahead of myself yet because I want to shore up a couple of things. But we've been working really diligently with our colleagues in other departments across the state to get more of those tests here in the state for use, not just in schools, but in places like pharmacies. So we're starting to see that ease a little bit. We now just have to make sure we solve the last mile problem, which is to say it's all well and good for us to have tests in our warehouse, but we've got to get them to the parts of the state where people really need them.
Thank you. And one last thing, we are seeing as we get deeper into flu season or kind of approach it, and then it's the convergence with the Delta variant and flu season. What do you see for our hospitals, and how do you think that they would be able to weather kind of what might be the case? Again, I hate to crystal ball it, but we are in that season right now, and we're talking about flu shots. So, how do you see this happening?
Yeah, and Megan, you're asking the exact question that our team here within the walls of the Maine CDC is discussing and thinking through as well. So you're right on point. Obligatory public service announcement: please get your flu shot for all the reasons that we've talked about, to keep yourself safe, to keep your family safe, but now also to try to keep our healthcare infrastructure as low stress as possible, because we need the healthcare infrastructure to be available for everyone who's acutely ill, whether it's from COVID or with the flu. And the more folks we can keep out of the hospital, the better off our fall and winter will be. Megan, hospitals are strained. When I check in with hospital leaders, what I hear is they're managing, but it's tough. Beds are at a premium, space is at a premium, and certainly staff who have been working now for 19 plus months are about as tired as you can imagine, and we're just getting started with respect to flu season. So hospital capacity, even though it has eased just a little bit in the past 4 or 5 days, doesn't tell the full story, because although the COVID numbers may have come down just ever so slightly, now we've got flu on the horizon. I can't speculate as to what this year's flu season will be. Some epidemiologists are concerned because last year's season was thankfully crushed. Others see some positive signs based on the flu experience that the Southern Hemisphere had. Only time will tell, but we don't need to just let it happen to us. The more folks get vaccinated against the flu, for sure, the better the flu season will be.
Thank you.
Let me go to Patty White next.
Thanks, Dr. Shah. Can you just tell us how you think the rollout of the booster shots, how that's going? I think we've administered about 16,000 so far. Is that higher or lower than you expected? And do you have any sense of which eligibility categories are getting it the most?
Yeah, Patty, one note there. I'm glad you raised this. We've administered about 16,000 additional doses and boosters. Additional doses were authorized by the US CDC and FDA around about 5 or plus weeks ago. These are shots for individuals who are, say, severely immune compromised. And on the day that boosters were administered, we had authorized, we had already done about 10,000 such shots. Since then, we've added about 6,500 additional shots. So the way that I'm looking at it in terms of the numbers, Patty, is that we've done, as of this morning, probably about 6,500 booster doses on top of about 10,000 additional doses for, say, the severely immune compromised. I'm pleased with the rollout so far. That's the bottom line. As I referenced, I stopped by the site in Sanford at the former Marshall's building on Saturday to check in with the staff, as well as to talk to people who were there. Folks said that they had heard about boosters from social media, their friends, and traditional media, which I was pleased with. They were eager to get their booster to stay safe, to keep themselves and their families safe. The reason I wanted to talk about it today was to clarify and boost the signal even further. We've also been working with providers, particularly those who are in long-term care facilities, nursing homes, and their residents, to make sure that they were linked up with a provider who could come on site and give the booster to those who got Pfizer. So I'm pleased with it so far. Of course, we're only about 4 days in, so we've got a ways ahead of us, but all signs are that we're in good stead right now.
Okay, thanks. And then I've got a question about vaccine hesitancy. You've talked about in these briefings how addressing hesitancy really comes down to one-on-one conversations, and ideally those are with healthcare providers. But I'm wondering at this point if that's enough, if you feel that more people need to try to broach this topic in personal relationships, because I think most people try to avoid them. And you said that you're doing an aggressive ground game to boost vaccination rates. I mean, do you kind of feel like more needs to happen, I guess, at the community level?
The answer is yes. There's no question about that. We can always be doing more to communicate the safety and value of getting a shot. One of the things that I've been thinking through as ways to inject a bit of spice into the holidays is to equip folks with ways to have a civil, productive conversation around boosters as we go into a time of the year when more folks are indoors, maybe seated around a dinner table, to try to give folks tips and facts on how to broach that difficult conversation. There are a couple of groups that I think can be effective messengers. Patty, you referenced healthcare providers, and they consistently rise to the top of surveys for trusted messengers. But family members can be important. And I think there's a new group that's emerging, which are kids. And this has been something that's on my mind, but there's some interesting, not to be too academic, but there's some interesting research that suggests that when it came to two other big public health movements, smoking cessation and seatbelt wearing, kids proved to be very effective messengers, effectively going to their parents and saying, I don't want you to get hurt. I don't want you to get cancer. Will you wear a seatbelt? Will you stop smoking? And so making sure that kids who are concerned about this know what to say and how to say it, that's something that my colleagues and I across the country have been trying to think through and how to be effective in that manner. So we certainly need to be doing more as a state, as a country. The question is where we go here next.
Okay, thank you.
Thanks, Patty. Let me go to David from the BDN next.
Great. Thanks, Dr. Shah. New data released by Northern Light today shows an increasing number of vaccinated people being hospitalized within their system, including about 30% of all patients in the ICU. These numbers are much higher than they were a few weeks ago. Has the Maine CDC noticed this trend, and why might this be?
Sure. David, there are two things going on there. We've noticed this. It's been occurring at the institutional level, at the state level, and at the national level. Let's first note, David, that there are wide fluctuations in those daily or weekly numbers because thankfully the numbers overall are small, relatively speaking. And so when we're talking about 20 or 30 people in a particular ICU, small fluctuations in the numbers of vaccinated versus unvaccinated can translate into big shifts from day to day on a percentage term. Just as recently as 2 weeks ago, in some of the ICUs in Maine, they were nearly 100% unvaccinated. But it does shift. And there are potentially two things both going on at the same time. The first is what's called the base rate effect. In effect, the more people who get vaccinated, even though the chance of a small percentage of them landing in the ICU with a breakthrough case remains the same, if the number that you start with before you apply that percentage to goes up and up and up, the raw number that gets spat out at the end itself will go up. So that's one thing that's happening. The other thing is there's the possibility of some degree of waning immunity, particularly for those who already have a pre-existing health condition. That's why for those who are in the categories I mentioned, David, 65 and over, those with underlying medical conditions, or those whose job or occupation puts them in the line of the virus, getting a booster is a smart thing to do.
Great, thanks for explaining that. And my second question is, and this, you touched on this a little bit earlier, but I was looking at the numbers today for a percentage of Mainers who've gotten at least one shot. In Somerset County, 63% of eligible. Cumberland County is 89% of eligible. You know, these two counties really aren't that far apart. What is making them have such different vaccination rates?
David, that's a question my team and I have talked about. I can't speculate or get into the minds of those in one county versus the other. We have done surveys, however, at a population level to get a sense of what's driving those concerns. Earlier on, by earlier on, I mean, 6 weeks ago, the number one concern that we saw that was noted in surveys in both counties when we talked to people who hadn't been vaccinated was a concern around side effects. It wasn't a concern around the immediate side effects, the sore arm, the fatigue you get. It was a concern around the unknown long-term side effects. When we've repeated those surveys, that continues to be the number one reason why folks across the state, rural and urban, suggest that they don't want to be vaccinated. We're at the point now, though, David, where billions of doses, I believe over 6 billion doses of COVID-19 vaccine, billion with a B, have been administered around the world to over 3 billion people. So in my view, the data are in. It's now just a matter of translating that in a way that folks who are on the fence will decide to come in and get their shot.
Just one quick follow-up, because I've been to some of these communities with lower vaccination rates. The misinformation in rural communities seems like it's a big problem. Have you seen data that show it's a bigger problem in rural areas than urban areas?
David, I have not. I did listen to a very illuminating program just yesterday on Maine Public about misinformation. I was actually curious about that very same thing. I myself have not seen such data, but that doesn't mean it doesn't exist out there. I'd certainly be curious to read about it and figure out what the messaging implications for our agency would be, though.
Thank you so much.
Yep, thank you. Let me go to Mal Meyer next.
Thank you, Dr. Shah. My questions are about the call center and vaccination website that was launched earlier this year. We found that their use has slowed to a crawl. Why didn't the state pursue these options sooner, knowing there would be a massive vaccination effort underway?
Oh, we certainly did, Mal. I think Brian Sullivan, we can roll the tape and recall the number of times that Brian brought this up. We certainly did pursue it quite early on. It turned out that many healthcare institutions, particularly the two largest ones in the state, for them and their patient populations, it was just as easy for them to do the scheduling in-house. But that doesn't mean the effort was for naught. Indeed, as we've made some pretty fundamental upgrades to that scheduling platform, just in light of the booster push. In particular, we've improved the value proposition of a provider using that platform called Schedulo, such that a provider who opts to use it, those vaccinations that are administered through that scheduling platform will automatically be reported into our Maine CDC vaccination registry. And as a result of some of those improvements, we've actually seen providers who have said, oh, I want to use that now. For example, the mega site that is still in operation in York County, run by York County EMA, has opted to use Schedulo for all of their scheduling for boosters because of that improvement. The other thing that changed fundamentally, Mel, was we very quickly moved away from a need to schedule people and moved pretty quickly to a walk-in basis, which of course obviates the need to have a scheduling platform. But Schedulo still exists, providers are using it, and folks can still call the community vaccination line if they'd like help getting a shot scheduled.
You mentioned Schedulo just now, and we found that in August, it didn't book a single vaccination appointment. Was this a good use of taxpayer money, knowing that it cost us millions of dollars?
Yes, it was. In August, there was no need for anyone to book a shot. Virtually every single vaccination site in the state of Maine, arguably in the entire country, was using walk-in vaccinations. The more appropriate time frame to look at was when vaccines were being scheduled. And there, for the providers who were using it, it was an invaluable tool. As we get back into boosters and then think about pediatric scheduling, doing, for example, clinics on site in schools, where it may be different groups of providers in a community coming together in a school gym to do vaccines, having the option of using Schedulo free of charge, and then having those vaccines automatically reported into our state database, I think that's going to be invaluable. Having that resource available, I think, is a great use of taxpayer funding.
Well, I hear you saying that it was worthwhile, but we found that at least the Vaccination Hotline, which is has a $4 million plus contract with the state right now, has only booked definitively only a couple thousand appointments. So was this really worthwhile?
Yes, there are multiple reasons for the Vaccination Hotline to exist. One of them was to book vaccines for people who needed them. But the overwhelming reason to have the vaccine hotline there was to answer questions. The individuals who staffed that hotline were equipped not with just the ability to answer or to book appointments if needed, but also to help folks navigate different websites, figure out what times places are open, figure out which sites were offering J&J versus other vaccines. So it was just as much of an informational resource as it was a booking resource.
Thank you.
Thanks, Mel. Let me go to Chris Costa next.
Hi there, Dr. Shah. Was trying to keep up with you speaking about the breakthrough cases a moment ago with David. I wanted to just make sure I'm understanding correctly before I ask my question. Are we seeing rates for the number of vaccinated people going to the hospital like staying even? Are they increasing? I just want to make sure I understand what's happening there before I ask a question.
Yeah, no, it's I'm glad you raised that, Chris. As of last week, which is the last time that we ran the models on this set of data, we had not seen an increase in the percentage of vaccinated individuals who were going to the hospital or in the ICU. That could change, of course, as we get deeper and deeper into waning immunity. That could certainly change. But what we were seeing is effectively mainly a function of this base rate effect. More and more vaccinated people, and thus the same small percentage of them experiencing a breakthrough case just translates numerically into more cases. It's a rather insidious and somewhat ghoulish byproduct of the fact that we're really vaccinated. In a state where only hypothetically 10% of the population were vaccinated, there wouldn't be that many breakthrough cases. But we are, as I mentioned, the third most vaccinated state in the country. And as a result of that, we may have more breakthrough cases.
Okay. I know that we've kind of talked a lot about how much more contagious the Delta variant is, and that even for vaccinated people, they can carry a larger viral load in their nose and mouth. And the reason I had a question about this is because I know there are many places, whether it's a music venue, sometimes small businesses of certain kinds, are asking people to either show proof of vaccination or a negative test result. Because of the Delta variant causing that higher viral load, would there be any recommendation from the CDC, or can you help explain why it wouldn't be something where everybody would need to show a negative test result if in fact the viral load is still high in vaccinated individuals because of Delta variant?
That's a great question, Chris. And the answer is I will try to explain it. So here's let's first start with the baseline. For an individual who is vaccinated, they can, on occasion, rarely, still have enough virus in their nose or in their nasal passages that they could spread it on to somebody else. And when that happens, it can be with the same intensity of spread as someone who's unvaccinated. But we have to start the analysis by noting that the likelihood of a vaccinated person spreading COVID-19 pales in comparison with the likelihood that an unvaccinated person could spread COVID-19. The unvaccinated person will do so, can do so, at a many higher fold risk. But to your exact question, Chris, great question. Why is it, if there can still be virus in the nasal passages of a vaccinated person, don't we require everybody to show proof of a negative? Well, reason number one is that it's statistically so less likely to happen in a vaccinated person. The second reason is that a number of papers now have shown that even when there is detectable levels of virus in the passages of someone who is vaccinated, the likelihood that that virus is what the technical term is replication competent. That is to say that that virus, I'm waiting for Josh to translate that one or interpret that one. The likelihood that that degree of virus exists in enough concentration in a vaccinated person is exceedingly, exceedingly rare. It's not zero, but it occurs so rarely as to not really make that frequent testing needed for vaccinated folks.
Okay, thanks for the patience with that one. I was just kind of grappling with that one for a bit. We have seen a lot of viewers asking us sort of I don't know if it's a hypothetical or a situational question, but one thing we're seeing a lot, and I'll try to paraphrase it as best I can. If there are 100 people in a room or in a given location, at a park or something like that, if 99% of those people are vaccinated, why does that last one person need to get vaccinated? Hasn't everybody else provided sufficient protection? That seems to be the question we're getting from a lot of people, particularly on social media.
Yeah, it's again a solid question, Chris. And this gets to the concept or the term that we used to throw around, in fact, that you asked me about on one of these briefings about herd immunity. And in fact, I think your exact question was, back in the day when the math suggested that that threshold was 70%, what happens if we didn't get to that? Now, what has changed is that because of the greater infectiousness of the Delta variant, much greater infectiousness, the percentage of folks that you need to be vaccinated in any population to prevent an outbreak or exponential growth has gone from 70% for the pre-Delta now to over 90% or around 90%. So in your hypothetical, Chris, if there were 100 people in a room, 99, let's make it even more extreme, 1,000 people in a ballroom, 999 of whom were vaccinated, that one unvaccinated person, their risk of getting COVID through a breakthrough case or something of that nature is exceedingly low, exceedingly, exceedingly low. But the question is there anywhere out there that can consistently get to 90+% vaccination rates? Difficult to do, but I think you can see how this connects with our moves to make vaccination a condition of healthcare worker employment. The closer we can get that number to, the less room the virus has to run.
Okay, thanks for your patience with me on those two questions. My last question hopefully should be short and sweet. What is the most common piece of misinformation about COVID-19 vaccines that the CDC is seeing or hearing?
I think, Chris, right now, the most common remains questions and concerns around fertility. Individuals who are worried, both men and women, worried that the vaccine may somehow affect their ability to have kids now or in the future. And based on everything we know about mRNA vaccines, the J&J vaccines, vaccines in general, as well as now the billions of people who have taken the vaccine, there's no basis to believe that your fertility will be affected in any way by getting vaccinated. Indeed, the best thing you can do to make sure you're taking care of your family now and your family in the future is to be there for them, and vaccination helps you do that.
Thank you.
Thanks, Chris. Let me go to Steve Collins next.
Hi, Dr. Shah. Something you said earlier about relying on children to try to push some of the people who haven't been vaccinated to do it. I'm curious if you could talk a little bit about what can you possibly do to get more children to be advocates for you.
Yep, and I want to thanks, Steve. I want to be clear. We're not talking toddlers or anything of that nature. We're talking, adolescents, older kids who frequently have these conversations with their parents, kids who themselves are eligible. This came up. It's come up in my conversations with the U.S. CDC, as well as conversations and with other counterparts, based on the experience, the positive experience that we saw equipping adolescents with information about smoking and the deleterious impacts of smoking, as well as with seatbelts. Steve, I'm not going to tell you we've got a 5-point plan yet, but I think the big picture is that what we saw with those two prior efforts, and probably there are others, is that parents they may not listen to the folks they see on TV, may not even listen to their own doctor, but when it becomes real for them by virtue of having their child bring it to their attention, that registers on a different set of notes. And so what some of my colleagues and I have talked about are ways that via social media, we can equip 16-year-olds with ways to have difficult conversations with their parents around getting vaccinated. Some of those 16-year-olds may themselves wish to get vaccinated and are facing resistance. Some of them may have already been vaccinated and are now urging their parents to do so. We're still in the how do we think about this stage, Steve, but I can tell you based on the experience and some of the data that we've seen from those other prior efforts, I'm not going to promise this is going to solve it, but it could add to some of the information that's out there.
Yeah, I mean, I remember bugging my grandparents to stop smoking, and they did. So
I remember bugging my dad to wear a seatbelt, and he did.
So it can work.
Yeah.
Anyway, that's good. Thank you.
Thanks, Steve. And the final question for the afternoon goes to Kevin Miller.
Great. Thanks, Dr. Shah. I want to go back to the positive cases that are coming in as well as the backlog. So can you tell us how many positive test results are typically coming in on a daily basis, and kind of shed light on what that tells you about where we are in the surge? I know it was up to 600 some a day a couple of weeks ago. Where are we at now?
Yep, sure thing, Kevin. We're at right now between PCR and antigen about 550 per day. That has come down a little bit. It's a good thing. It could go back up. So we're not done. We're not out of the woods yet. But as you note, not too long ago, with PCR and antigen combined, we were receiving at one point last week well over 600 positive results every single day that needed to be reviewed, vetted, deduplicated. It's come down a little bit, but as a result of that small diminution, plus adding even more people, I think we've added now since last Wednesday, 13 additional individuals. That's how we're going to make progress on moving through these. Kevin, you and I have talked about this on numerous occasions, but I just want to underscore, this is not the same backlog as even 3 days ago. It's a function of getting in 400 to 500 to 600 tests a day and being able to process them. So it is a completely different backlog than what it was even just a few days ago. And again, I said it, but I just have to say it again. These folks are not finding out about their positive status from the Maine CDC through this process. They're finding out from their lab. They're finding out maybe from their provider, finding out from the platform, the immediate notification platform that we've set up. This is really a back-end clerical process. It doesn't affect how we think about the pandemic, doesn't affect our positivity rates, anything like that.
Okay, great. And I'm glad you mentioned that latter part, because you talked earlier about how case numbers are only one metric you look at, but it is a very high profile metric, and it's easy to understand for folks like me in the media and to the public, and people pay close attention to it. The numbers that we have today are the second highest we've seen reported in one day. The ones yesterday for over 3 days. I guess what can you say just about the numbers that you're seeing based on the positive results that are coming in, that rate, and kind of where that puts us at this stage of the pandemic? Where are we in the pandemic?
Yeah, sure thing, Kevin. Let me provide a bit more color around the case number, and then I'll zoom out, widen the aperture a bit. On the case number itself, generally speaking, when we get, let's just say hypothetically, we have 1,000 new cases that are reported in a 24-hour period. When we go through the process of vetting them, deduplicating them, if they are in New Hampshire residents, sending them to New Hampshire, when we go through that entire process that's involved in chewing through this, of every 1,000 cases, about 800 will be true new cases in the state of Maine. So about 20% have to be removed. If we didn't do this process, we would be overstating our new cases by about 20%. That's why doing this methodically and accurately is correct. What that also means is that when there's an upswing and a surge, every single day we're not reporting the number of new cases, and we're off by about 20% each and every day, if you know what I mean. That's kind of the difference. So of the 2,500 cases that we have remaining to review, about 2,000 of those will turn out to be really new cases. So that's kind of where we are. But when our team is sitting down thinking about how we're thinking about things, to the latter question you raised, Kevin, we're seeing in the panoply of COVID indicators, there's present indicators and then there's lagging indicators. And generally speaking, they go positivity rate, hospitalizations, and then deaths. The positivity rate is probably the best indicator of where the pandemic is today, particularly if you break out the numerator and the denominator. We talked about the numerator a moment ago, Kevin, 500 to 600 cases per day. The denominator has been going up. That's the 19% that I mentioned earlier. So overall, that tells us that there's some signs of easing. It's way too early to tell what those mean and how durable they'll be and how far they might go. They could go back up tomorrow, but that's phase one. The next is hospitalizations. There too, we've seen a little bit of easing, but boy, not a lot. We hit a peak on hospitalizations last week. We've eased off ever so slightly from that. So it's still too early to see or know whether we'll go down any further. The other metric that we look at, Kevin, is a ratio of various ratios within hospitalization. What percentage of all hospitalized patients are needing intensive care? What percentage of all intensive care patients are needing ventilation? And what we've seen with Delta is higher percentages for both of those. That is to say, patients who get to the hospital are sicker. That's not a Maine specific finding, it's a national finding. There's an open question about whether those folks have delayed care and present to the hospital in a sicker state, or whether Delta is making them sicker at the outset, probably a combination of both. But within that, Kevin, we look at those percentages and those metrics. And then finally, deaths, as you're well aware, that's a lagging indicator. When you take all that together, there are some very early, way too preliminary, unclear signs of that there might be an easing, but not taking that to the bank yet.
Great. And just and one other thing I wanted to make sure I understood when we're talking about the positivity rate. You said, the 19% increase in testing is obviously a positive sign. And the drop in the positivity rate from 6% to 4.6% is also a positive sign. And as a non-scientist, when I look at rising positivity rates, to me, that says that there are more positives out there. That even if you're expanding the number of tests you're doing, if your positivity rate is still rising, that means there's more positive cases out there. Can you make sure can you explain that a little more to me? That way I can get my head around it.
Yeah, sure thing, Kevin. The positivity rate is just a simple fraction of the number of new PCR tests, positive PCR tests that we've gotten over the last 7 days, divided by the number of total PCR tests that have been done. And thus the positivity rate can go up or down through movement of either the numerator or the denominator. What's happened in the past 2 weeks in Maine is that we've seen the numerator, the number of positive tests, that's come down a little bit, as you and I were just talking, from round about 600 a day to mid 500s. Still a lot. That's come down a little bit. The other thing that's happened is the denominator has grown significantly. That's the 19%. So when you put those in our mathematical model, which you and I talked about well over a year ago, when we put those into the model, that's where we get the change in the positivity from 6.1 to 4.6. It's accounted for by a slight decrease in the numerator and a big increase in the denominator.
Okay, great. Thank you very much. I appreciate it.
Yeah, you bet, Kevin. And thank you all for taking a little bit of time out of your afternoon to join us. Very much appreciate the conversation with our colleagues in the media, as well as for all of you for taking a little bit of time to hear the latest with respect to COVID-19. Things are still unsettled. There's still a lot going on, and we're not out of this yet, which is why you'll see me here next Wednesday, probably for a couple Wednesdays after that, to provide you the latest information. The news right now is challenging. As I mentioned, there are some signs of optimism on the horizon, but there's still a lot of signs for concern. I want to make sure that every single person in Maine knows that they will hear that news from me, even if it's not great. You'll hear it uncoded and making sure that you have every piece of information you need to keep yourself and your family safe. With that, thank you all for your time this afternoon. As always, please be kind and take care of one another. We'll see everyone next Wednesday.